that measures the electromagnetic charge of the points on the ear. So it's kind of like a stud finder. It makes a little noise when it finds the point. So we're going to look around here and just scan the area. Oh, here we are. Okay, so there's the spot right there. Okay, so, and that is the spirit gate point for stress reduction. So we're going to use this little pellet. It is gold covered, gold plated. So it has a kind of gold has a soft, relaxing quality to it that helps smooth things out. So we're going to tape that on to this exact spot, and you can keep that on for up to a week. And you can even stimulate it if you want, like at a stoplight, or if you're watching TV or something, you can just stimulate that to help induce the relaxation effect. Okay.
Okay, thank you.
You're welcome. So you're all done.
I think that when your eyes were closed, that we all set this up on you in that one moment, because your eyes were closed and I could have said to everybody, pretend. Well, we're gonna try it in reverse this time. Okay. I'm gonna see if you can connect with your dad in the opposite direction. Close your eyes. Open your eyes. Did you feel anything?
Yeah.
What did you feel?
Doing a warm-up on toddler feet, just checking in between the toes, checking the skin. Kids are pretty resilient. They usually can tolerate more heat and more cold, and their nerves are working fine. Now on to the adult. Testing the adult feet with the Ipswich test is basically touching the first, the third, and the fifth digit. The patient has their eyes closed, and they can basically tell you that they can feel that you're touching their feet. Now the directional test, we're going to push their foot or their toe towards them or towards the tester, and their eyes are closed, and they should be able to tell you forward or backwards. Now the next one here is just a little strength test. They're pushing against your hands and pulling against them, just kind of checking their overall strength. And then we're doing a capillary refill, checking for a 3 second, making sure that their capillaries are filling back up. Nail polish makes it a little bit more difficult, so we just kind of test the skin. This is any discrepancies, then that they are both equal. Checking between the toes for any cuts, fungus, anything that's not quite normal. Checking the skin, the heels, the side of the foot, the top of the foot, to make sure you don't have any calluses. Next is the monofilament test. Basically, we're going to demonstrate on our own hand that it is not a needle, it is not painful, and then we will demonstrate it on their hand, and then we will begin the test on their feet. Some people use exactly the top of the foot, some will use between the first and the second toes, and then test both of the feet.
Wait. Now we're going to focus on the palpation of the posterior aspect of the foot and ankle on our model. I'm going to go ahead and start talking about some of the areas that I commonly like to palpate. Coming down through the gastrocnemius muscle, palpating down through the myotendinous junction, and then to the part where the muscle becomes tendon, or the Achilles tendon, and coming into that attachment point of the distal Achilles tendon onto the calcaneus. This can be a common site for something called insertional Achilles tendinopathy, which is very common. If I squeeze on either side of that Achilles tendon, there is a retrocalcaneal bursa that's there that could develop in some patients with repetitive injury, repetitive trauma to this area. And so that's why it's always important to palpate right in here. And then as I move my way down into the plantar aspect of the foot, I do like to palpate out toward that calcaneal fat pad, or that heel fat pad. And then I'll palpate through there, and coming down into the area of the calcaneus where you have the origin of the plantar fascia, as this is commonly associated, if somebody has pain here, can be commonly associated with plantar fasciitis or fasciosis. One of the
at the insertion of the Achilles tendon, as is commonly seen in a Haglund's deformity. One can walk towards the forefoot at the MTP joints, and again, either look for a prominence of a bursa or tenderness. Evaluate the presence or absence of pain or deformity by just simply doing a quick maneuver of each toe and a quick maneuver for palpation and for tenderness as well. And then finally, range of motion, as we talked about before. And then I think as well, palpation across the midfoot to determine if there's any bony palpable tenderness, or specifically, oftentimes a patient may have an arthritic spur or a dorsal boss on the top of the metatarsals. One maneuver I think that's particularly important in assessing that, if the person does have pain on the top, would be to do exams where you do a sagittal stress, where you can move what you believe to be a painful joint and exacerbate that stress by sagittal plane motion and determining if that causes an exacerbation.
So Juliana, can I take your pulses?
Yes.
All right, so when we take your pulse, in Chinese medicine, we're actually doing both sides, because in Chinese medicine, there's 3 different positions on each side with 3 different depths. So there's actually 9 different positions that we're feeling on each pulse. And what they do is they reflect, like right now, I'm feeling how energy is flowing through the lung channel in your body.
Right. So Duncan, this movement's up, and this direction's up, and that direction's down. Okay, so it's down, that's up. Okay, close your eyes, tell me which way it goes.
Up, up, down, 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 up.
Cool. And now we'll do the toe. Okay. So same story. This way's up. This direction's down. Okay. Which way is that?
Up.
Okay. Close your eyes now. Yeah. Good.
Up, up, down, down,
And then make the movements quite small.
down, 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 up, up.
Okay. And the important thing to notice is holding each side of the toe like this, not like that. Okay. And the same applies to the finger. Thanks. You can stop there.
And that's a nice present pulse, it's regular. And then I'm going to feel along the posterior medial aspect of the ankle for the tibialis pulse. And that's appropriate as well. The next part of the exam classically is going to be an evaluation of sensation. In essence, there are 5 distributions of a foot in terms of peripheral nerves in the level of the foot. The dorsum of the first web space, the deep perineal nerve. I'm going to ask the patient whether or not this feels natural, or this feels fuzzy, tingly, zingy, or absent on occasion, or hypersensitive. Going to touch the dorsum of the foot other than the first web space, which is the superficial perineal nerve distribution. Going to touch along the outer border of the foot, and that is the sural nerve distribution. On the inner border of the ankle and foot, the saphenous distribution. And then finally, plantar medial and plantar lateral branches of the tibial nerve. So those.
When I pull his great toe up, we can see the arch elevates, and when the toe drops down, the arch drops. Toe up, arch elevates, and this is because the windlass effect of the plantar fascia, a flexible subtalar joint allows this to happen. The plantar fascia originates on the bottom of the calcaneus, and it ends at the base of the toes. If we dorsiflex the toe, we pull the heel toward the metatarsals by the so-called windlass effect, the arch elevates. This happens in a flexible subtalar joint foot. So it's another way of demonstrating subtalar joint.
Now knee jerks, but if you can do it, lift both legs up together, just let them relax. Thanks. And you just want to tap between the patella and the tibial tuberosity on the tendon there. And then for the ankle, just passively, just apply some passive tension to the Achilles tendon, just let that be. That's it. And then this one, just put the flat of your hand there, passively stretch the Achilles tendon, and that's it. And now for the plantar response, the end of the hammer's okay if it's not too sharp, but just protect her with the end of your finger, and just use that and bring it up the outside edge of the sole of the foot and across the ball of the foot like that. The same on the other foot, just bring it up here and across there. Good.
Stressors of the modern day world. So this area up here helps the brain. This is part of the Japanese style And the Japanese style that we're doing is rooted in both the ancient Chinese classics and also modern science and physiology. So these points are really great for stress, and research has shown, because it also affects the dorsolateral prefrontal cortex, that they happen to also be good for people with anxiety and depression.
Interesting.
And this should be a very relaxing treatment. Okay.